I believe clinical integration is the key to our future. I believe that supply chain is one of the levers, along with several other business integration and business operations to help the delivery of care from the clinical perspective. The opportunity we have is to work collaboratively to improve the overall outcome of the patient's experience.
One of the biggest challenges to creating or achieving a clinically aligned supply chain are the traditional barriers and silos and the lack of conversation that exist in many organizations. A more clinically aligned supply chain means that we are partnered with our clinical providers in evaluating cost, quality, and outcomes with the goal to impact the value that we're bringing to our patients, whether it's within the four walls of the hospital or now extending out into the non-acute areas, and what that means, in fact, to impacting health, not just patient care.
For me, clinical integration in the supply chain means that we're operationalizing the concepts around the cost, quality, and outcomes moving. This concept that the healthcare supply chain is perfectly poised at the center, at the intersection of cost, quality, and outcomes. And because we're there, we have the opportunity to solve healthcare problems, not just supply chain problems.
Supply chain needs to be more clinically integrated. And what I believe that means is to understand and work with clinicians in a way that provides the supply chain informatics, the information necessary about what we buy, how much we buy, and how much we pay for it. And that integration really is taken to clinical committees in a way that they can then understand as they work to reduce variation in their practice, they can also integrate and reduce variation in the products that we use. That's the intersection of cost, quality, and outcome.
I had the privilege of chairing the Clinical Integration Task Force for the AHRMM Board for this year. And we convened a multidisciplinary group of several physicians, nurses, pharmacists, supply chain professionals. And what we found in just those initial discussions is every discipline had a different approach and different vernacular or jargon as how they looked at a problem. And so by looking at across all of those perspectives, we were able to really learn that our communication within supply chain really needs to expand and to become more enhanced to meet all of the clinicians in an area that they feel most comfortable.
My role sort of evolved with the value analysis team, first sitting on the committee and then starting to work with the different clinical groups, mainly the surgical groups, the different subspecialties, to get them aligned and able to participate in the processes.
A strong value analysis program can really be the springboard into supporting and helping to promote clinical variation reduction, service line projects, developing formularies that incorporate clinical variation reduction.
As we talk about clinical integration, it is natural for us to talk about evidence-based decisions. And in the evidence world, health technology assessments, HTA, is a standard process that we utilize. It's something that resonates with doctors. They understand HTAs. They understand evidence-based research and information. And what evidence-based decisions do for us ultimately is they move us from subjective, I like this, I've always used this, to the evidence shows that the outcomes are either superior or equal, and now I can make a decision based not only on what I like, but what the clinical evidence shows has the better outcomes. And then we add the third piece of that in, and that's cost. So I can then again look at the cost, the quality, and the overall outcomes.